Welcome. Another great self-help video I want to share with you. It's about blocking out pain, tricking the brain. The majority of pain that we have occurs in the upper trapezius muscle. You'll notice that even if you're having nerve irritation from a disc herniation or just arthritic or disc bulging or just something that's inflamed along that nerve root, you'll generally notice that when you turn your head from side to side or your muscles in your back of your traps feel tight, they're pulling underneath the head, behind the skull, which can cause headaches and other symptoms. But the upper trapezius muscle is innervated by the C3 and C4, that's a cervical fourth and cervical third nerve root, as well as a spinal accessory, which is cranial nerve 11. So you have the cranial nerve 11 as well as the third and fourth cervical nerve root innervating the upper trap muscle. When that becomes inflamed, that can be quite painful. So the little self-help video we're going to do today is we're going to trick the upper trap, and we're going to go ahead and try to contract the rhomboid, which is right below it, innervated by the fifth cervical nerve root, the dorsal scapular nerve. So we're going to trick the brain, because right now the upper trap being innervated by C3, C4, as well as the spinal accessory nerve root is on fire. And that's generally where we're going to have most of our referred pain. Generally those traps are always involved with nerve root irritation. But what we're going to do is we're going to contract the rhomboid muscle innervated by the C5 and dorsal scapular nerve. So my left upper trap is hurting me right now. So what we're going to do is I want you to take your left hand and just put it on your left knee. You can bend the knee like you're sitting on a chair. Just rest it carefully. I want the whole arm relaxed. Now, if it's your right side, you're going to put your right hand on your right knee. So the pain is in that trap region, limiting your range of motion. We want to get rid of it. Quick, I mean fast. Remember, the brain knows is C3, C4 spinal accessory nerve. The brain doesn't know that we're going to bypass that and we're going to contract the rhomboid. As we stimulate the rhomboid, we're stimulating C5 as well as the dorsal scapular nerve. So my left trap, my left neck is hurting me. So that means I put my left hand on my left knee. If it's your right side, you'll put your right hand on your right knee. Okay? Now, so what I want to do, I'm going to take this left arm, all right, and I'm going to squeeze my left shoulder blade to my spine. Pinch it back. It's going to come around like this. So I want you to squeeze it and hold it. Go ahead and hold it for like 10 seconds. Just that one side. Don't do both. That is the trick to this whole technique. Okay? So if it's your right side, you're going to come around and pinch your right shoulder blade to your spine. Pinch in. If it's your left side, it's your left shoulder blade to your spine. Relax it. Okay? We're going to do it again. So it's kind of like a little arc. Now you notice that your left hand or right hand will stay on your knees. I don't want them dangling, because if they dangle, you're not going to get the full motion that you're trying to accomplish here. So my left rhomboid contracts. Push your left rhomboid, contract it, push your left shoulder blade to your spine. You'll notice that this one side of your chest, your left side may stick out. If it's your right side, you'll notice maybe your right side may stick out. Hold it for 10 seconds. Pinch it, relax it. Do it again. Pinch that blade, the inside of the shoulder blade to the spine, and hold it. And it kind of hurts, but it feels good. You're fatiguing that rhomboid muscle. Okay? And relax. The reason why we don't want you to do both of them, because we don't want the chest to come out. It's not going to get the same effect what we're trying to bypass that upper trap. So remember, if it's your left side of your neck, left hand on the knee. If it's your right side of the neck, right hand on the knee. Whatever hand is on the knee, that's the side you're going to contract and pull that inside of that shoulder blade to the spine. So when you come around and you'll notice just a little movement, look at my shoulder back here. Just it comes back a little bit. As it comes back, that means I'm pinching that left shoulder blade right now against the spine. So remember, your hands are on your knees, arms completely relaxed. If it's your left side, just pinch that left shoulder blade back. Look at my back of my left shoulder. Just pinch it and hold it 10 seconds. If it's your right side, just your right side. Pinch back and hold it and pinch that shoulder blade just 10 seconds to the spine. Squeeze that shoulder blade to the spine, and you're going to hold for 10 seconds. And what you're going to do is you're going to do 12 repetitions. So it's really, how long is it going to take you? No time. So remember, as you pinch that blade, Try not to stick your chest out. Just pinch that blade and hold it, because our objective here is to work the rhomboid. By working the rhomboid, we're bypassing the trap. And as you do it, the first set that you do, you're going to feel release of pain. Now, you can do this as often as you like, because this can hopefully help you get by with a lot of the pain and suffering you're going through until this condition continues to repair and heal. But as long as you can contract that muscle and bypass that upper area, hopefully it will take a lot of pain away. The nice thing about this technique is there is no harm whatsoever. I really hope this technique helps you. Remember, this is all about form. When you squeeze those rhomboids, imagine the inside of your shoulder blade getting closer to your spine. Keep those hands on top of your knees. I ask you to leave your comments below. There are thousands of people who read these comments. I'm sure that you guys can share experiences and help each other. I ask you to share the video with those who can benefit. Please subscribe if you haven't, so you can continue to receive the best of the self-help videos here on the internet. And most important, make it a great day. I'm Dr. Alan Mandell.